Neglur, consultant diabetologist practicing in Thane and also attached to Jupiter Hospital, Thane. Today we're going to discuss about COVID infection and diabetes, how it's important. We all know that the diabetics are prone for infections. That's why people with diabetes get scared that they'll get more infections or are they more susceptible. But just to remind you that just being diabetic is not enough to be susceptible to get infections. It is important that if your diabetes is not controlled, then only the susceptibility is very high. It is true that in diabetes, if the sugars are higher than 200, that your immune system does not work well. And that's why the infections like influenza and pneumonia are very common in diabetics. And that's precisely why every doctor says you're about 2 years older, then you must take shots for either pneumonia or influenza vaccine. So that's the reason why we emphasize so much. We also have history in the past that when we had H1N1 in 2009 and when we had something like MERS infection in 2012 and 2013 and SARS infection in 2002 and 2003, that time the diabetics behaved very badly. So far as COVID is concerned, we have very limited data so far as the infections and COVID and diabetes is concerned. Now we feel that diabetes is uncontrolled. The fatality rate is somewhere around 7.5% compared to 3% in a general population. Now to take care of diabetics during these epidemics, we give a lot of advice. This advice is based on the guidelines. What the guidelines say, there's an Indian guideline as well from the RSSDI. It says that being diabetic does not mean that you're susceptible for the infection. Controlling diabetes is very important. Take all your drugs very carefully and regularly. Do not stop the drugs on your own. Always consult your doctor before stopping a drug or starting a higher dose or lesser dose is always better consult a doctor. Now, most of the times you are in-house, you are bound in-house, so the exercise becomes difficult. You can do exercise at home because you can't go to crowded places like gym and all those places in the garden where it is not possible for you to go now because of lockdown. So spend your time exercising at home. At the same time, eat a very balanced diet because you are sitting at home all the time, watching the TV all the time. You are tempted to eat all the food that is available at home. So avoid that kind of attraction or temptation of eating food when you feel you're watching television. So that's important because you need to control your diabetes as well. This Dr. Ann Peters, she is from Keck School of Medicine from south of California. She has given a lot of guidelines as well for the American Diabetic Association. What are those guidelines? She says if the patient is taking SGLT2 inhibitors, he should stop the medicine. That's important. If anybody of you taking canagliflozin, dapagliflozin, all these drugs should be stopped because these drugs can precipitate a complication like diabetic ketoacidosis, which requires admission to hospital. So avoid taking these kinds of tablets because they can produce a serious complication. It's also important that if you have taken drugs like sulfonylureas, and even insulin, if your sugars are on lower side, try and trim down on low sugar levels tablets on the lower side. Don't stop it, but trim it down as low as possible so you don't get into hypoglycemia. Because low sugar hypoglycemia requires hospital admission, and most of the hospitals are now crowded with COVID patients, so it becomes difficult to get you in a hospital. So therefore, avoid this complication, which is easily possible. The next important thing that you should remember that most of the patients were taking on GLP receptor agonist. And after COVID infection or during COVID infection, also many patients complain of lack of appetite, nausea, vomiting. Even in those patients, the drugs like GLP receptor agonist should be stopped because they can profoundly affect your appetite further. So these drugs should also be stopped. So therefore, it's important that you must take the guidelines from doctor, take a help from doctor, to adjust these medications because they might create a problem during this particular epidemic of COVID. And lastly, which is very important, according to Ann Peters, she said if you have any complications of diabetes, immediately seek the help of a doctor because he can guide you properly. Do not delay your seeking help from doctor because if you delay, a complication sets in, it will be difficult for a doctor to manage at home, then you require to get hospitalized. So therefore, to avoid that, you need to do this very important thing. Besides this, many people give a lot of fake messages, a lot of wrong messages on television, on WhatsApp. So don't fall prey for that. Take authentic information and only follow the authentic information. As I said, that diet exercise is the mainstay of diabetes management, and that becomes difficult sometimes because of this lockdown. But do not, as far as possible, get away from your schedule as you were doing earlier. Any method of exercising which is comfortable at home can be done. Just walking up and down or jogging at one place itself is quite sufficient to give you the benefit of exercise so that your sugars are controlled well and also gives you psychological benefit. You can also do yoga, which is a good form of exercise during lockdown, and you can get benefit out of that as well. A lot of people complain that they have a lot of spare time, they don't know what to do, they get confused, and they feel that the watching television is boring and listening to the news always talks of COVID, 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 it's depressing. So what do we do? The best time for this is to get in touch with your friends, your colleagues, your members of the family who are distant, talk to them, inquire about them. You have a social distancing, but you don't have emotional distancing. Make the emotional distance shorter by communicating with your friends, colleagues, and relatives who are either here or abroad, so that they'll also feel that you've done a good job for them. So with all these words of encouragement, I wish you have a good health in diabetes. And we know that the doubling time is increasing. It's almost 10 to 12 days today. And the RO time is also shortening. So we probably feel in a 2 to 3 weeks time, the lockdown can be lifted and you can be back to your original schedule. But remember, even if the lockdown is lifted, the restrictions will remain. The virus may not go very easily. It's going to stay for longer time. So therefore the social distancing, exercise, avoiding the crowded places is going to stay and maintain those disciplines which are very important to have a good, healthy life. Thank you very much for listening to me. I hope these words will help you, will encourage you, and see you in a good, healthy spirit. Thank you.